Hello, class. Well, I'm back with more information on nursing informatics that you can use for best practices. As I told you in the first part of the clinical care classification, that it consisted not only of a terminology that's coded for documenting nursing practice, but also that it has an information model and knowledge that represents knowledge representation, which represents the second part of the clinical care classification system. It's a system, not just a terminology. This is the model of the information representation. As you can see, it consists of all the parts that I previously described. But they are all linked together, and they therefore are interrelated and intertwined. The model outlines the nursing process for documenting professional practice and follows the 6 basic standards or steps as outlined by the ANA. It also represents the scientific method using a standardized language and represents how nursing and nurses think when planning and providing patient care. The information model represents the 6 steps of the nursing process. The first step is assessment. The signs and symptoms are used and assessed to identify the patient's problem and/or to determine the appropriate nursing diagnosis which will require nursing care and which represents the second step of the nursing process. There are other things on the sides, like its code, that I am not going to go into, but I always put the code for anything that depicts the concept of a diagnosis, intervention, or outcome. So you get the feeling, even though you will not see it if it's in an EHR, it's always in the background and it's never shown, or the nurses never have to worry about it. The third step is represented by the goal or the expected outcome of patient care for each diagnosis in order to achieve the quality outcome measures. The goal is always represented by 3 qualifiers: to improve, to stabilize, or to deteriorate, or support nursing deterioration. The reason we use these 3 goals are because the government requires goals in their documentation, and the goal is critical to see if on discharge it does meet and it has been resolved or not. This is critical to nursing care, and it gives value to our services that we have provided. And the last, or the 6th step, is the actual outcomes, as you can see here. That's also used for the expected and the actual. But in the middle, we have the determination of nursing interventions and actions, which consists of the 804 nursing interventions. Each nursing intervention provides a service or action. It's generally based on the combination of the admitting medical orders as well as the assessed nursing orders. So each nursing intervention also includes one of 4 actions. That means that it is to assess, perform, teach, and manage. Now this is a little new and different than most terminologies, and the reason it's been put that way is because when you provide wound care, that's very general. However, if you're teaching the patient about wound care, you would have a different requirement in time to handle the teaching. If you assess, that may be very quick and take only a short time. If you manage, that is all the indirect care that is provided just to provide the wound care. So these 4 qualifiers we found in our statements that were being processed, and we put them in. They are there separately, so you can add and subtract and aggregate separately from the rest of the statement. So we have 2 parts to each statement of interventions in our terminology. And the last step refers to the outcomes again. As I said, the outcomes and the actual expected outcomes and the actual outcomes are the same, and they're used just to provide the differences of what happened when you provided the care for that 3 days, 4 days, or 5-day episode of illness. Now, this next slide shows the 5-6 steps of the nursing process. It shows the various concepts from the nursing terminology and how they are all related to each other. We like this model because it can always depict the patient's status during a hospital administration. You could have a snapshot view of the patient at any time of the admission. You can have a snapshot view at the change of shift, or at the change of a unit, or on discharge. We've tried it, we've tested it, and it does work. To further illustrate how the CCC terminologies is used to document nursing services, I'm now going to illustrate a hypothetical use case using the CCC system for documenting and processing a patient plan of care.